So we're here with Dr. Colin King, professor at Acadia University. Before we get going, Colin, can you tell us a little bit about your educational background and experience in athletic therapy?
Sure, yeah. So I did a Bachelor of Kinesiology at Memorial University in Newfoundland. And then that's kind of where I became first exposed to athletic therapy. I actually worked as a student trainer, not under an athletic therapist. They had a program there that was kind of led by a strength and conditioning guy that kind of knew a little bit about it. Didn't really know much. At the time, there was only one certified AT in the whole province. So I shadowed him a bit, kind of got interested in professions, and I ended up doing my athletic therapy then in Sheridan College. So did a bachelor's in athletic therapy there as well. And then after that, kind of worked out in the field for a while. So I got a job working in the Quebec Major Junior League with a hockey team there for 2 years. And then the team moved, so I had a choice of moving with the team or looking elsewhere. And so I decided a job came up at Acadia, so I applied for a job here and worked with the football team here, and then started teaching a couple of courses, and then that's where I kind of got interested in the whole teaching side of things. So I ended up going back and doing my master's in education, did a master's in post-secondary education from Memorial as well, and then continued on to my PhD in educational studies from right here at Acadia. So kind of my experiences in athletic therapy, so I was here for 5 years working with a football team, so I kind of did some of my education stuff while I was still working here, and then now kind of transitioned more into a professor, research, kind of supervisory position now.
Awesome, awesome. So we're examining advances in technology and how that's affecting player safety, specifically in the sport of football. So concussions have been a major issue in our sport. Can you tell me a little bit about the current concussion protocol and the return to play process?
Yeah. So I guess kind of even though I don't consider myself to be that old, like obviously we know much more about concussions now than even when I first became certified, right? Like when I first was learning about these things, it was still all grading, 1, 2, 3 of a grade scale of a concussion, and it was all based on specific symptoms or loss of consciousness, and it would really be if you lost consciousness between 0 and 30 seconds, it was a grade 1. 30 to 60, it was a grade 2. Longer, it was a grade 3, and so it was really kind of try to measure the specifics. Now, kind of has changed more so. I love using the analogy of Jim McLeod right now. He always says it's kind of like you're pregnant. You can't be kind of pregnant. You're either pregnant or you're not. Same thing with concussion. You can't be kind of concussed. You either have the concussion symptoms or not. So I think that's kind of one of the biggest changes is from that piece. I mean, like everything, it's a very difficult injury to try to assess. So it's more of trying to include some objective tests, and that's where everyone's trying to go now, trying to determine, what test can I do to tell if someone has a concussion. And they're really trying to do some of the biomarkers now. Can I take a blood sample of you and see a certain protein released in your bloodstream that lets me know that you have a potential concussion, you shouldn't be playing. We're not at that point now, so we still rely on the subjectivity of the athlete and based on their symptoms, but also really kind of watching the athlete is a big thing as well. Are they doing things that they normally don't do after a hit? Those kind of things. So then when you recognize concussion, really the return to play protocol, it's kind of a gradual return, so trying to just increase physical demands and see if running around increases symptoms, and basically you're trying to just gradually return them to play without just being asymptomatic and thrown right back into full contact. And it's all about just making sure that there's no red flags coming up along the way.
Awesome. So with technology advances in contact sports or collision sports, football included, the use of wearable technology is now being implemented. So sensors can be put in helmets and shoulder pads that send data to smartphones or databases that can measure impact to help to get an idea or an understanding of player impact, force, and if that data can help in the diagnosis of concussions. Is that something that you would recommend going further? And do you think we'll ever get to a point where that's going to be standard protocol for contact sports?
Yeah, I mean, the thing with it is we're still so early on, right? All these groups are still collecting so much data, and in theory they sound like great ideas, but there's so much that we still don't know about it. So it's difficult to say of endorsing or recommending a very specific thing to say that yeah, every football, every hockey, every rugby should have these things implemented in there. And kind of guess why it's so difficult is we know that concussions, even though they're core, or I guess related to impact and amount of force, but we know that it's not just significant amount of force correlates to exactly having a concussion. I mean, I'm sure you've seen huge hits in football where huge impact, athlete gets up fine. It's the sometimes the indirect forces where the athlete's unanticipated, not watching, looking another way, gets hit and ends up with concussion signs and symptoms where they're out for a long period of time. So where it's not directly related, that's where everyone's collecting data and trying to figure out what does this mean and what can we use it for. So I guess my thing with the wearable technologies when it comes to that, I kind of think of it almost like a virtual concussion spotter. So if you watch like the football, like NFL, NHL, like they're probably the only two leagues do it, where they have independent professionals hired to watch those games. So if they see a big hit and observe the athlete woozy or doing something that they're not normally, they make a call down the sideline saying, hey, you gotta check out Shad. He's not cleared until he's cleared through the concussion protocol. So I see the wearable technology piece as being useful in that, where if someone had a significant amount of force and you didn't see it, I mean, in football, like you get caught watching the play and the stuff happens everywhere. So oftentimes it happens away from where your eyes naturally go. So at least having something like that, like you said, can give a little alert on a cell phone saying, hey, so-and-so just had a significant impact, he should be checked for a concussion. So that's where I kind of see it as being a useful piece, is that if someone had that significant force,
exactly,
but we know that concussions can happen without that significant force. So
awesome. So now your research involves use of technology and implementing it in the teaching process for your students. Can you tell me a little bit about that, how it's affected your current practice, and some positives that it may have brought to your practice or the students that you may have taught?
Yeah. So I'm one of the unique individuals where really most people in my profession that have gone on to do PhDs have all been in really focused in the science background, right? Like different rehab techniques or ex-phys type things. But so mine was really focused on more, like you said, the whole pedagogy, teaching side of things. And so what kind of got me interested in this is thinking back to my experiences. And we know technology is a piece of everything we do, right? And teachers are using it on a daily basis. But I always think back to when I was a student, like how it was being used, and it really wasn't like it was just kind of used to PowerPoints and just to deliver material and things like that. So I started looking into how can we actually use this to help us do things that we can't do without the technology. And it kind of introduced me to a very specific framework called the TPAC framework, which is the designers of this model kind of say in order to use technology effectively, you need to integrate the technology piece with the pedagogy, with the content knowledge. So basically using technology in a pedagogically effective way to teach that course content. So teaching it in a way that you can't do it without that technology. So not just doing it for the sake of using it or just very superficial reasons, like really thinking about how can this help me better my teaching. So I've used it and kind of developed a couple educational tools that kind of integrate a bunch of different videos and different animations, and we use it to kind of create a contextually authentic, as what I like to say, injury scenarios. So I'm training students that need to go out and be health professionals. So one of the things they try to do when they're practicing is they try to come up with scenarios of, yeah, you have a knee injury, yeah, I have pain here, what test would you do? So what we kind of done with these educational tools is we integrated different technologies to kind of create the same experience for all the students, so that if everyone comes in, they see the same mechanism of injury, they see the same type of swelling, they see the same restricted range of motion. So it kind of takes the assumptions that a student is making, which can affect their ability to interpret information and think and all those kind of things. So we're trying to really use it to help build up their competence and help to build up their skill development in a bunch of different ways. So that's kind of one example. I'm getting involved a little bit more in some of the simulation mannequins. So I have I would say a mid-fidelity CPR dummy. So it's just like a traditional CPR dummy, but I can actually hook a little iPad up to it. So if you're doing it, it tells me your compression rate, your compression depth, and it gives me very specific feedback on you're not pushing hard enough, you're not pushing in the right spot. So we've kind of used that tool in a couple of different ways as well of how to teach students how to effectively do CPR, and as the research shows, is that's more effective than your regular Actar half dummy head or whatever for doing the compressions. So I'm kind of playing around with a couple of research projects in that area as well. So
Awesome.